Hello doctors. Today we learn on topic on urinary bladder, and you can see in this picture two ureters, urinary bladder, and the ureter at the end there is an ureter orifice and urethra and sphincter. And this is the basic concept, like, and you can draw this picture in exam also. You can see here apex, base, inferior lateral surfaces, your neck, prostate, prostatic urethra, superior surface, and your ligament. Let's go some detail, but this is a diagram. You can also be drawn an overview for your easily way. Let's its location is in anteriorly lesser pelvis behind the pubic symphysis, and in front there is a rectum in male and uterus in female. So it is the location of your urinary bladder. Some of the external features: when it is in empty bladder and when the urine is filled, that is your full bladder. When empty bladder, there will be a tetrahedral shape. Your apex will be forwards and base will be backwards, and your neck will be lowest. When it is a urine filled full bladder, there will be ovoid shape. Apex will be upwards and base will be downwards. Some of the ligaments of bladder, there will be true ligaments and false ligaments. Your true ligaments are nothing but your fibrous band around the neck and having at the base of the bladder. And your false ligaments, it means there will be a folds of peritoneum and do not have some proper or supportive function to it. And your ligaments, for the true ligaments, or there will be two lateral ligaments, four puboprostatic ligaments, one median ligament, and two posterior ligaments. When there is false ligaments, there is two lateral ligaments, two posterior ligaments, median umbilical fold, medial umbilical fold, median and medial umbilical fold. These are your false ligaments. Next, coming into its relations of urinary bladder, at the base there is rectovesical pouch in male and vesico-uterine pouch in female, and vas differentia and seminal vesicles. Your apex, there will be a median umbilical ligament. Apex will be in median umbilical ligament. As you can see in this picture, your apex is connected to the median umbilical ligament. Next, your neck is a prostate gland in male and urogenital diaphragm, it is in female. Your superior surface, it will be peritoneal cavity, and there will be some coils of ileum, sigmoid colon, and uterine cervix. And anterior surface, there is obturator internus, levator rani muscles, puboprostatic ligaments. So these are some of the relations of the urinary bladder. Next, there is interior of bladder, and it can be examination through the cystoscopy. Suppose if the bladder is empty, you can see some of the greater part of mucosa with some irregular folds, and it is due to the loose areolar tissue. And the base of bladder, there will be a small triangular area that is called trigone of bladder, and it is in triangular shape called trigone of bladder. When the apex of trigone, it will be directed to the downwards and forwards, and the internal urethral orifice opening into its urethra, and there are some of the openings are 2.5 centimeters apart in the empty bladder and 5 centimeters apart in the distended bladder. And you can see a slight elevation on trigone immediately posterior to the urethral orifice produced by the median lobe of your prostate, that is called urethral vesicle. And at the base of trigone, it is formed by the interuteric ridge or bar of Mercier. This is most important. Base of trigone is formed by the interuteric ridge or bar of Mercier. And the capacity of bladder, it can be hold up to 220 ml of capacity of bladder. And the blood supply, it is by superior and inferior vesical arteries in female, uterine and vaginal arteries. And venous drainage, it is by vesical venous plexus. You can write in this way. Next, your lymphatic drainage through the external and internal iliac nodes. Nerve supply sympathetic by T11, T12, L1 and L2 nerve roots. Somatic fibers by a pudendal nerve. And your applied aspects you can write in this: incontinency and retention. So some of them, it will be any stress incontinency, like there will be a stoppage of urinary in that, and there will be blood cancer also, and it can be a trigonitis. As I said before, there is a base of bladder, small triangular shape, called trigonal bladder, and any inflammation to that area, it is called trigonitis. So these are some of the notes on your urinary bladder. For further more updates, subscribe, like, share. Thanks for watching SPN.